The effects of childhood obesity surpasses childhood and potentially affects their psychological and physical health throughout their childhood and into adulthood. Parents and guardians are capable of preventing the issue of childhood obesity by altering their child's diet and physical activity. Without these changes, the well-being of the child is at stake. Obesity Action Coalitions defines childhood obesity on their site as the body mass index for age percentile is greater than 95%, and express that obesity affects more than 30% of children, making it the most common chronic disease of childhood. Healthy People 2020 has set a goal to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. According to Healthy People 2020, those who are at a healthy weight have decreased chances of developing chronic diseases such as high blood pressure, dyslipidemia, type 2 diabetes, heart disease, and osteoarthritis. There is also a smaller chance of experiencing complications in pregnancy and dying at a younger age. Park, Faulkner, Viner, and Kenra studied the correlation between childhood obesity and the associated chronic diseases. These authors noted that high body mass indexes in childhood can be associated with kidney cancer in men, ovarian cancer in women, along with strokes in older men and several other coronary heart diseases. There are health complications that can affect the obese child and continue to have its effects through adulthood if he does not reach and maintain a healthy body mass index. CDC.gov lists cardiovascular diseases, such as high cholesterol and high blood pressure, as a couple of the complications that can be gained from obesity. In a sample study, the CDC found that 70% of obese children between 5 and 17 had at least one risk factor for cardiovascular disease. Children suffering from obesity can undergo bone and joint difficulties and sleep apnea. Mayo Clinic defines sleep apnea in two forms, obstructive and central. Obstructive sleep apnea is the illness that often accompanies childhood obesity, in which the child will stop and start breathing continually throughout the night. Childhood obesity is a modifiable risk factor of all of these health complications. By altering the child's dietary and physical activity habits, these complications have a lower chance of affecting the child, both in his youth and as he ages into an adult.